Hello and welcome to another episode of Life, Are We There Yet? The self-progress podcast which seeks out ways to lead as fulfilling a life as possible on this ridiculous journey that is life. We are your bumbling hosts, Isaac Rookmore.
Hello.
And I am Jack Henderson. On today's episode, we'll be having our first look at one of the most pressing issues around today, that is mental health. Now, a large number of people in the UK and worldwide suffer from some sort of diagnosable mental health problem. But even those that don't will almost certainly go through episodes in their life of particularly high anxiety, stress, or even depression. Mental health issues are something that anyone can be affected by, so we think it's vital that we talk about it more. But what do we know? So we thought we'd get someone who actually knows what they're talking about on the show with us today, someone who has seen his fair share of problems over the past 30 years, having worked in the medical profession. But first, Isaac, Maestro, roll the theme tune.
Up and down, left and right, you say we should, I think we might wander for a while. Up and down, left and right, you say we should, I think we might wander for a while. And we came here from somewhere and we could go anywhere else, just don't ask me, are we there?
Now, today's guest has around 30 years professional experience as a GP. He's a media medic, released books and been on the radio. And I'm going to stop now before I inflate his ego any further. We are joined today by Dr. Roger Henderson. Yes, that's right, my dad, because we are operating on a budget of nothing. Dr. Henderson/dad, thank you for joining us. How are you, sir, today, since I saw you all of, half an hour ago?
Last time I looked, I was very well, and thank you for inviting me to your excellent studio, or as I like to call it, my house.
Thank you for having us. So why don't we just crack on? I will ask the first question, and that is, I guess, why do you think it takes people? Because in my case, it took me a sort of breakdown of sorts before I reached out for help. So why do you think it takes people to get to a very bad, troubled place mentally, often culminating in something like a breakdown, before reaching out? If they do, why do we find it so difficult to talk about mental health concerns when, say, if you have an infection or a virus, you'd go to the doctors and get treatment without a second hesitation?
I think that's a very big question, and
apologies.
There are lots and lots of answers that make up one complete answer to that. The first one probably is that there is still a degree of stigma around the phrase mental health. You go back, 150 years, and people paid to go into Bedlam and look at mentally unwell patients locked up, and it was like a circus show. Now, obviously, that was a complete travesty of what we should be doing, and it's taken quite a long time over the last 150 years to actually eat away at a degree of stigma around mental health. I think one of the problems is that you can't see mental health. If you've got a broken leg, if you've got a chest infection or tonsillitis, if you've got a obvious visible problem, then it is often far easier to go along to a health professional and say, look at this, I've got a problem.
Right, you can. It's quantifiable.
It's quantifiable. Some people with mental health issues find it very difficult to actually verbalize how they are feeling. It can be a big thing for them to go and sit in front of a GP or a doctor and say, this is how I'm feeling, because they don't have the tools, the verbal tools, to actually eloquently describe how they're feeling. There also is a degree of shame, because many people still believe that you should be able to just crack on and man up, if you like. I mean,
we don't like that phrase here.
men are notoriously bad at coming forward with any health issue compared to women, if I'm honest. Although, interestingly, when they retire, they attend the doctors the same amount of time as women do. But certainly, men of a working age, and certainly younger men especially, do, for whatever reason, whether it was their upbringing, whether it was peer pressure, they feel that they often can't approach their doctor and say, I have a problem. Now, that's not That's not their fault. It's just the way that they view this particular issue. I think it is getting better, but this stigma around the mental health issue is still there. Now, we are breaking it down slowly, but it's a very gradual process. I think it had accelerated in recent years, and that's great. I think the last 5 years has really seen an explosion in awareness of mental health, and I think that stigma is dropping, and part of that is the rise of social media and social media awareness.
Do you think, I was going to ask, is it a question of there are actually more, people are suffering from more problems now because of the world we live in, or is it just people are more open to talking about it? Say because of social media and such, like, are we more susceptible to mental illness than we would have been, say, 50, 100 years ago?
I think that we probably are slightly more susceptible to mental health issues. One of the problems from 100 years ago, or even 50 years ago, is that the vast majority of people with, for example, low-level depression or anxiety just didn't report it. We have no reputable figures, really, from those days as to how much of a problem mental health issues were. So we've got better recording of mental health issue statistics these days. We've certainly got better awareness when people are better at coming forward and explaining about their mental health issues. But again, 100 years ago, if you talked about mental health, you would talk about depression. You would talk about melancholy. You might talk about anxiety. If you didn't talk about PTSD, you talked about shell shock. And what has happened in the last sort of 10, 20 years is that there has been a gradual expansion and awareness of the massive variety of mental health issues there are. It is not black and white. It's not like it's depression or it's anxiety, and that's what you've got. There's this rainbow now of conditions which, if I'm honest, weren't really considered, when I went into medicine 30 years ago. So you didn't really sort of think about post-traumatic stress. You certainly didn't really think about things like generalized anxiety. You certainly didn't think about sexual identity issues. You didn't really think...
well, it's certainly much more, I guess, binary and not this sort of spectrum which it is now.
Exactly. And that's a good thing that we're now sort of, if you like, teasing out individual mental health problems in the individual rather than just lumping people. Well, you've either got anxiety or you've got depression or you've got something else.
It's so much easier to categorize, but that's because it's, as you said, it's so much broader than that.
Exactly. Even things like bipolar disorder. Again, it really wasn't talked about sort of 30, 40 years. It really wasn't recognized that well. And so mental health treatments have become much more individualized, which is only to be commended. But that's not just medication. Again, going back to the start of my career, if you were talking about mental health, you really had, give them a pill, or there's not really much else, and the pills sometimes weren't great. You're now talking more about specific counselling treatments for mental health issues than pure medication alone. Obviously, it's usually a combination of counselling and medication, but we're seeing a much more individual, tailored treatment of people with mental health issues than just to hit them with a chemical kosh and diagnose them with one or two labels.
Yeah, so we're definitely going to touch on the topic of medication versus therapy later on. However, it must be noted that we are all males here in the room. So
no.
So as young males, it seems to be a particular problem, sort of the 18 to 30-year-old bracket. Why do you think it is such a problem for young guys, and why do they find it so hard to open up about it?
Huge amount of peer pressure. I mean, there is peer pressure, obviously, amongst younger girls. But in young men, and that can be because of sport, if you've been brought up to sort of play rugby or to be the rough and tumble of being a man, it can be very difficult to then come under that carapace of masculinity, and it's well known. There have been many studies in both younger men and older men looking at attitudes towards opening up about both mental and physical health issues, and we are notoriously bad at it as men. I think younger men, not just mental health, younger men really would struggle about coming out with sexuality or their sexual health problems because of the fear of how they may be judged, and that's very often peer judging. Now,
even if it's subconscious,
even
it's
if
just what you've grown up with. If you've been in that sort of environment, that arena, then it's what you're conditioned to, isn't it?
Absolutely. I mean, the old cliche, about whether it's the Jesuits or the Catholic Church, or whoever you want, give me a child for the first 7 years, and I'll give you the man. Essentially, what that is saying is, the early part of development in younger life will shape how you are often, how you think, and how your attitudes may be. And if you've been brought up, very much as the archetypal patriarchal family, and this is how you are viewed to view life, then it can be very difficult to, when you start to think for yourself in your teens and early 20s, to think, actually, this is not me, and you have to have a high degree of courage very often to say, actually, this is me. What was viewed as me is not me, and you only really get that with a degree of experience and help, often with looking at other people in the same boat and realizing it's not just me, because many men are sort of between 18 and 25 with mental health problems will all say to me, I thought it was just me with that problem.
I'm alone in this.
I'm alone in this.
That's one of the sort of irrational things about mental health. No one understands.
Exactly.
It's got to be just unique in me.
Because everybody puts that face on. Everybody puts the face on. You get up in the morning, you paint the face on. And you ask someone with a significant mental health problem how they're doing. Their default answer is always, "I'm fine."
Yeah,
I'm fine. And then you've always got to take a beat and go, okay, that's great. Now tell me how you really are.
Yeah.
Okay, we've got that one out of the way. Okay, let's park that one. I know you're not.
Yeah.
I know you're not. Let's just talk about how we are.
Just habit. Yeah.
But I'm fine because many people don't want to get into that conversation. It's too much effort. It's too much like hard work. You don't know what response you're going to get if you actually say to someone who asks, "How are you doing?" You go, "Actually, I'm feeling absolutely awful. That I could break down at any time." Some of the time they'll look at you and go, "Oh, right, let's talk about something else."
Because whereas if you go, "I'm fine," they can go, "Oh, nice weather, isn't it?" You can just revert to small talk.
Yeah. So you've got. It all depends on the person you're speaking to, and you've got to be able to sort of pick the person to have that conversation with. Now, that can be with your GP or with your health professional. It can be with your best mate. It can be with a parent, although many people with mental health problems really struggle to sort of speak to their parents because, they
I'm smiling currently.
because they have views about, how their parents might react. And it's actually the case that some parents will be absolutely fine, as I hope, I am, and some parents will, not want to hear what's being said. So you pick the person to have that conversation with.
I was just going to ask, sort of linked to that, about the 18 to 25, 18 to 30-year-old bracket, not just males now, but females in general. There's a lot of talk in sort of, the news and the older generation saying these fragile snowflake millennials. I just wondered, to what extent do you think that's true? Because I think, from my point of view, I don't think we're particularly fragile, considering what we've been exposed to and how, say, with social media and whatever, how we've been brought up with that. That's a lot more to take on now. But would you perhaps argue that there is a degree of fragility, and that the older generation know how to... I'm very sort of cautious of saying tough it out better, because that's the whole sort of man up mentality. But, there's got to be... You can't just wear your heart on your sleeve all the time, and you've got to live, ultimately. You can't just live every day on the verge of a breakdown.
Yeah, the older generation dealt with mental health issues usually by just ignoring them. you know, and let's not talk about them, and they'll go away. And they would just bury the issues that they had for all sorts of reasons, and because it wasn't what you did. And certainly those, you know, men especially that fought through the Second War had tremendous problems with post-traumatic stress disorder, depression, anxiety as a consequence, quite understandably, for what they'd endured and what they'd seen. And they didn't talk about it, and there was no treatment. Many of them did go on and kill themselves because they couldn't stand it, but it was how it was. Where we are now is we've got a greater awareness and much more openness about mental health issues. And because I think more of the younger generation talk about mental health issues, which the older generation never used to, it can appear at times that more people are coming out of the woodwork, and, you know, you get the snowflake quote thrown at them. Actually, I think what it is, it's actually just peeling away the scale of the problem. Now, social media is massively in there, both for and against.
It's a whole episode in itself.
It is a complete.
We're definitely going to do an episode.
Yeah, you're going to need to do
pros and cons.
Yeah, absolutely. But it's pretty much in a nutshell. You know, the pros are, it does allow you to realise, actually, I'm not the only person, you know, with this issue. The con side of it is that it promotes the fact that everybody is having a perfect life, you know, which is complete bullshit.
And you're constantly under scrutiny, you know.
Yeah. And so one of the things I often say to people with younger people with mental health issues is to say, if at all possible, really scale back on your exposure to social media. Okay, one, you know, most of your friends out on social media are nothing of the kind. They're just you know, someone that you are linked to, and, you know, probably if you never saw them again or they never saw you again, it wouldn't be a disaster. Secondly, you've got to realize that many people are putting out an advert for their life. You know, they are polishing their presentation as to how they appear. Relatively few people, you know, would sort of get up in the morning and post a picture on Facebook of them looking like a dog's dinner. You know, and I think girls are especially prone to this. You know, you make sure that the face is painted on. You know, and you know, you look at people taking selfies. You know, they tend not to take them in a particularly bad light. They're taking a selfie to show just how lovely they're looking.
We would, Isaac and I were discussing this the other day. We think, you know, and again, it's not their fault per se. It's just what they've grown up with, and it's seen as the norm now. You know, a lot of, and I think it tends to be girls, though guys do it as well. Their worth has become, you know, just solely defined and quantified by, say, the amount of likes they get on an Instagram picture, or, and as you said, it's a snapshot. It's not, they're living vicariously through this digital, artificial portrayal of themselves.
Yeah, I think as a very broad generalisation, this is a very broad generalisation, men will often post body images, or showing this is me looking hench. You know, I'm really sort of smashing this in the gym today. And women will often post, you know, me looking lovely, and this is a nice outfit, and this is me doing a certain thing, and I'm everything is lovely. And both of those are probably fairly unhealthy in the long run. So you've got to take social media with a big pinch of salt. But as I say, there's probably a complete episode in there for you.
Yeah, well, even with the sort of shorter form of social media, such as Snapchat and Instagram stories, for example, people are tending to curate that to a certain extent now, when its original purpose was to sort of capture more of the raw essence of daily life, and that just goes to show in itself where the trends are heading. And as a doctor, would you say some of the trends you've seen more recently in mental health in particular, are there any patterns that have emerged, or people that have surfaced as being perhaps a higher risk of having a mental health issue?
There are. I think anxiety and generalized anxiety people with those problems are floating a lot to the surface in social media. I think certainly in both sexes there has been quite a significant rise in probably the last 5 years of awareness of eating disorders and
Hello.
and related problems, and that has certainly taken off. And also, I think there's really been an awareness of what can be done in terms of treatment if you do have mental health issues. It doesn't mean that someone with a mental health problem actually knows the treatment they need, but they are then aware that treatment is out there and available. And Dr. Google is quite good at doing that. So I think it does allow, it's literally a tool in the toolbox, social media. It allows people to put out there, either to say, I have an issue and I'm looking for help, or to go looking and saying, is there anybody else feeling like I'm feeling? Now, you've got to be a bit careful, because you don't want to jump in a bandwagon. You don't particularly want to join a club, and there are people who don't have a mental health issue who can, if you like, catch on to the coattails of certain trends or issues, because it gives them a sense of belonging, and they feel that it is really where they are, when in fact they don't have a demonstrable mental health issue. But I think that's the minority. I think the majority of people who use social media to talk about mental health have a very good reason for doing so.
Both Isaac and I are on some antidepressant medication of varying dosages, but prior to starting them, I was really skeptical, and I think mainly because there is this stigma, as it seems to be with pretty much all mental health stuff surrounding them. And I don't know about you, Isaac, but I've hardly anything negative to say about them. Mm-hmm. They've been pretty much entirely positive for me. And I've read articles which have been completely scathing about them, and I've read online articles and this, that, and the other, and there still seems to be this, this unspoken thing that, oh, you're on them, but you shouldn't really, like, that there's something wrong with them, and I just wonder why that is.
I think we start from the starting point that one size does not fit all. Antidepressants do not suit everybody. Antidepressants can have very significant side effects in some people, and antidepressants do nothing in some people. And I'm especially talking about antidepressants here rather than other mental health medication. I think there's been a fair bit of skepticism because they have been prescribed very significantly in increasing amounts in the last decade by GPs. Not because GPs are being sort of fairly fast and loose with them, but because many people coming in with significant stress and anxiety, sometimes bordering on low-level depression, all a GP really has in their toolkit is medication or counselling. Now, ideally, for people certainly in very mild depression or severe stress with or without anxiety, counselling should really be the first port of call, because all the evidence is that CBT is as effective as antidepressants in the long run. The problem in the big wide world out there is that for most GPs it would take months for their patients to get to see.
And you're always told, you've come home many a time and complained how you're this 10-15 minute window that you're meant to give every patient, which is just completely unrealistic.
And that's,
and as you said, I'm sure you really want to be able to give more time, but day to day, in reality, you
are swamped by pure workload.
If it's a choice between prescribing a pill and...
Exactly, because for the most of the time it will do no harm. For the most of the time patients are relatively happy to be trying something. But I think we have been guilty in the past of prescribing antidepressants without explaining, look, it could well be a month before you feel any benefit. These are not a quick fix. These are not a happy pill. You will take these for quite a while and think, what on earth has he given me? Nothing is happening. So I think you have to explain how antidepressants work. Now, the majority of antidepressants prescribed in this country at the moment work on the chemical serotonin, we know without a shadow of a doubt that both with depression and anxiety, there is a massive impact on low serotonin levels triggering symptoms of both depression and anxiety. And it's, in a nutshell, what modern antidepressants aim to do is boost the level of serotonin in someone's brain. And by doing so, it alters their brain functioning and reduces the risk of depressive and anxiety symptoms occurring. But if you just give someone an antidepressant and say, go away and take those, they won't have a clue what they're meant to do. They won't have a clue of when they start to work. And, after a couple of weeks, they'll either say, well, nothing's happening, and they'll junk them, or they'll think, well, I'm going to have to come back and try something else because they're not working.
Yeah, it took me a solid 3, 4, even 5 weeks before I noticed any significant change in my mood day to day. And it is a bit, you're like, you get a bit impatient with it because you're told that this is what's going to help. And
And as I say, one size doesn't fit all. And very often, if you're 6, 8 weeks down the tracks and something isn't working, it doesn't mean an antidepressant isn't going to work at all. It does mean that you may want to consider trying an alternative. But they are not the happy pill that many people think they are. They should certainly be used, and I've got no issue with the way they are prescribed at the moment. But they must be used in conjunction, usually with counselling for mental health as well. I mean, it's not a one-size-fits-all. And as I said at the start of this podcast, it is just a tool in the toolbox. But many patients will come in and expect a pill and expect that pill to suddenly work and improve things. And, I suppose I can understand that. If you come in with a really bad chest infection and you need antibiotics, you'll have a few days around it.
You get a scratch or a
usually
bruise, you put a plaster on it.
Exactly. You usually start to feel better pretty quickly. Okay. And so many pills do work relatively fast, and antidepressants get lumped into that whole viewpoint that they're going to work quite quickly, but they don't. But, and I come right back to the starting point, they save lives. There's no question they save lives. They are not some kind of happy pill that just was going to make everybody's life. And I often say to my patients, look, I'm going to give you antidepressant. I explain what the rationale behind that is, explain how they work, and try and set them up for counselling at the same time. But I do often say to these patients, look, this is not going to make your life any less rubbish.
Yeah.
If your life
issues that are causing that are still going to be there, you're just going to be able to manage with them better.
Exactly. What this aims to do is get you back to the point where you are mentally stronger and able to sort of deal with many of the issues that have brought you to me in the first place. Okay. And if I know the patient really well, I will say, your life is still going to be crap. And they'll go, yeah, I know that.
But it's the kickstart you need.
It is, yeah.
Yeah, well, in terms of the benefits, and I think I speak for the both Jack and I when I say that it has been mostly positive. A side effect that I personally experienced is a lot of fatigue, a lot of tiredness. Maybe can you touch upon some of the side effects, and is there a danger of addiction at all?
Right, that's very good. That's a very good question. I'm often asked, are antidepressants addictive? No, they're not. Get that one right out of the way. What can happen is you can have people who are on long-term antidepressants. If they stop their antidepressants very suddenly, they can feel slightly odd for quite a few days.
Just a bit cold turkey kind
Absolutely. Just a little bit. The impact on the serotonin can really sort of make them feel a little bit unusual. And so I would never just suddenly stop someone who's been on long-term antidepressants. I would have a phased reduction, give them a smooth landing, if you like, as I often say. But in terms of addiction, no, it's not something that patients should worry about. The other point about side effects is that if you do get side effects with antidepressants, very often they are self-limiting and relatively short-term. So if you can keep going, okay, while your body is adjusting, many people report, they'll get side effects for the first sort of 2, 3, 4 weeks. But if they really hang in there and keep going, they ease away.
Yeah, I mean, I was the same. I got very tired. My sleep cycle got a bit disrupted, and within about 2, 3 weeks, it had eased off completely.
Yeah, I mean that's what happened. I think I went on a trip for a couple of days. Forgot to take them with me, and it was like being punched in the face. It really did hit me. But it goes to show, I think you do need that sort of smooth landing, as you said.
Yeah, so you've got the issue of potential chemical side effects, and then you've also got the other slight compounding problem where depression and or anxiety cause a lot of symptoms. Okay, and so if you start taking antidepressants and you're thinking, oh, I'm starting to feel a bit fatigued and tired, yes, it may well be the impact of the medication, but it may just as likely be the impact of the actual illness itself.
Yeah, I mean, I was equally tired before when I think about it. I hadn't been sleeping great for a while.
Exactly. Well, in specific side effects that people will talk about, they will talk sometimes about nausea, and sometimes I find that that can be eased a little bit if people take their medication with food. They will often talk about issues with insomnia or poor quality sleep, certainly early on. They will certainly talk about quite vivid dreams, or slightly odd dreams, anxiety dreams. Their dreams can go a little bit sort of into overdrive early on when they start taking antidepressants. And yes, they can start to feel a little bit more fatigued and tired. And if you look at the list of potential side effects, in a box of a modern antidepressant, you'll get onto sort of page 6. They are legion, but it doesn't mean that everybody gets them. And for most people, when you talk to, they're really well tolerated.
I think one thing that perhaps our listeners would be interested in hearing about is if they're struggling, they know what it's like. So if they were to see someone else, maybe a family member or a friend who's perhaps struggling a little bit, and I know a place where I've seen it personally is at parties or social events. When there's some alcohol involved, people tend to open up a bit more. And,
emotional drunk, yeah.
and tell you their life story. So if you're able to sort of spot those signs and see that there might be something deeper there, what would you advise?
And also, sorry, just what specifically you shouldn't do, because it's a very much a two-part thing.
If you do spot it, don't try and fix them all at one go. Mm-hmm. So the most important thing is probably to make them aware that you're there for them. And so all you have to say is, are you okay, really? And if you get any kind of feedback saying, no, I'm not, or they confirm that they're struggling, and it doesn't have to be then, it can be another time, you just say to them, look, I'm here. Just if you ever want to chat, just chat, I'll listen. It's not that you'll talk to them, you'll listen.
You're there to be vented out.
Exactly. The first thing to do is just be there to listen. And just by having someone that you can, as you say, vent out and actually break that ice and talk to. And so you could say to them, we'll chat any time, here's my number, or give me a call, send me a text, we'll meet up, we'll have a coffee, just chat. I'm there for you. And just by knowing that someone is there, that's the first massive step to helping someone start to open up. Second thing is, don't judge. If you've not had a mental health issue, you have no idea what that person's going through. And many of the time I've said to patients who've got depression, I've said to them, look, I have no idea how you feel. And for me to say, would be patronizing, to say the least. I'm not going to patronize you. I have no idea how you are feeling, but I do know what is likely to get you better. And I do know what we should be doing to actually try and help. What you don't do to someone who's trying to open up or looking for help, you don't say, you're okay, aren't you? And close it off. Okay? You don't say, the classic, pull yourself together. You don't say, you're going to be okay.
It's all in your head.
Yeah, it's all in the head. Yeah. You don't say, oh yeah, I feel like that too. Okay? That is patronizing. You don't know what they're doing. And people are very, very good at hiding how they're feeling. The majority of people in this country who commit suicide will have seen their GP or a health professional in the weeks prior to them committing suicide. Okay, and very often either those trigger points and their signs, their signals are not picked up, or they have just hidden them. They've decided, no, I am not giving anything away here. And it's not going to be fixed overnight. It's a very, very long journey. The old cliche, big long journey starts with one step. It is a cliche, but it is true. And in mental health, it's especially true. You've just got to start that journey. Now, that journey might take, a few weeks, in some people. In other people, it might be a lifelong journey. Okay, but you've just got to just allow someone the space and the freedom to say whatever they're going to say. So, usually that's why it has to be someone they're really comfortable with, because if they're saying things that never said to anybody else, or they're saying things that they may feel shame or guilt about, they've only got one chance usually. If they open up to someone for the first time and they feel that they've picked the right person to open up to, and that person then shuts the door and slaps them in the face, they may well never open up to someone in the future again.
Mm-hmm. And I think that's what me and Jack intended to set out and encourage these open conversations and don't close off this topic.
And when you can, don't make it a big thing, because the more you hype it up and the more you say, make it an occasion, the less likely people are often to talk about it. Because if it's a big thing, then it's more dramatic. Whereas you say, just let's have a chat. You still treat your friends exactly the same. You can still insult them. You can still, to and fro with them. Because if I was, my friend was like, yeah, we'll meet here at this time, this place. I'll get everything nice and ready and everything. That's just going to put so much more pressure on the individual. Exactly. Whereas if they go, oh yeah, okay, fine. As odd as it may sound, that can be as helpful, because yes, they've listened to you and they've acknowledged and recognised you, and their opinion of you hasn't changed.
Yeah,
and I think that's vital. And I think it's very difficult, and I think it's a two-way street, because it can be incredibly frustrating. I'm sure, Isaac, we've both been very frustrating over the last couple of years. We've failed on countless social occasions. We've been quite bad with it.
Too many to mention, really.
And so I think, as tough as it is, I would even argue there is a degree of accountability on the person suffering, that it is, there is a bit of give and take. As tough as it is, you've got to have the onus as well, really deep down, to think, I just leap of faith a bit and trust. Because otherwise, as you said, a lot of people act and they hide it and they put on a phrase. Sometimes your friends, no matter how close your friends are, no matter how good they are, they just won't know. You've got to give them something to work with, I think, sometimes, as tough as that may be. And, and it's not easy.
It doesn't have to be a close friend or someone that you know. Very often, some people feel much easier talking to a relative stranger, So again, that's why sometimes they go to the GP. In the old days, certainly, and still to some degree today, they may go to their local priest and open up, although that happens far less than it used to. Or it may go to someone they know relatively not well, but they've got that confidence because they're not approaching someone who is well known to them. So it really is horses for courses. Some people really want to speak to someone they know extremely well. Some people want to speak to someone they don't know well at all. And both are entirely valid. The key point is that you start the conversation.
We're going to wrap up in just a couple of minutes, but I just thought I'd use this, frankly, golden opportunity to interrogate you a little bit. You've spent your entire adult life pretty much helping others, but I would argue that you haven't perhaps been the best at opening up yourself. You tend to just get, very grumpy and grumble at the dogs.
Scandalous.
A lot. It's not fair on the dogs that there's no violence. He just gets a bit shouty. When you're under scrutiny and under high pressure all the time, as you have been as a doctor, as a medical professional, what are some of the insecurities you've had to deal with? And linked to that, how have you dealt with them or addressed them? Is it in fact still something you're learning to get better at?
Oh, absolutely, all the time. And I think for the rest of my days, I'm going to be learning a bit about myself. I'm slightly got to sort of fess up here and sort of plead guilty as charged, because I was brought up essentially to starch my upper lip every morning.
You wouldn't believe it, but he's from the north.
And, I am a slightly stereotypical sort of, man up and get on with it. But I have learnt over the years to deal with that. Paradoxically, being a GP, I think, has helped me, because I have learned from my experiences with patients the right and the wrong way to actually deal with stress. And I think the job has also crucially given me a massive degree of perspective. And I think I'm sometimes asked the question, what would be your one major tip, your anti-stress tip? Not anti-depression, but anti-stress tip. And I suppose my anti-stress tip would be keep a sense of perspective. I have a massively lucky life. I have a roof over my head. I have food to eat. I have a loving family. I say that, and I'm looking at Jack. Yeah, I'm just taking that as read. I'm very fortunate in being, in a very happy long-term marriage. I have a good circle of friends. Very few, but they are hand-picked, and they are solid, and they are sound. And all these things make me realise just how happy I am and how lucky I am. I think in terms of what I would be saying if I had my time again, would be, one, it really doesn't matter what other people think. That is a massive one. I used to really worry about what other people think, and it is so liberating when you realise that actually, provided I'm not sort of breaking the law, being ridiculous,
yeah,
or
don't
being
go joining an Islamic State,
thoroughly unpleasant, it doesn't matter what other people think. Secondly, being yourself is so important, and getting the work-life balance is so important. Again, you'll have heard it many times, but I have never, in all seriousness, never heard anyone on their deathbed say to me, Doc, I wish I'd spent more time at the office.
Yeah.
You've got to try and get that balance right. We've all got bills to pay. We've all got mortgages to feed. But having said all that,
mortgages to feed,
none of it matters. The banks. You'll learn one day. So,
okay.
The banks are rapacious and they need feeding. But
getting lectures there.
So just be yourself, and if in doubt, have the conversation. Don't be afraid to say. And if there are people out there, I'm sitting on social media that sort of want to troll you or say, "Oh, I don't agree with you." Fine, you don't agree with me. Move on. Jog on. It doesn't matter. The world is still going to turn, and you'll be there the next day.
The birds will still be singing.
Exactly.
Life goes on.
Life goes on. And you don't have time. Life's too short to stuff a mushroom. As it used to be said in the 1980s, life is too short to be dealing with people you don't need to deal with.
Too right. And that's something as millennials, I think we're coming to terms with on a daily basis.
Oh yes.
I think at the end of each episode, we want to ask our guests for a little bit of a maxim or a mantra. In this day and age, it's all about the little sound bites, and we're going to just jump on the bandwagon.
We want something quotable.
So yeah, if you could just give us a little piece of advice that you'd have for getting through life, maybe for the day to day, or maybe something to keep with you on a longer term basis.
Your legacy.
Legacy.
Oh, I shouldn't have said that. It'll be his head's big enough as it is.
I'm afraid I've already spent your legacy.
Yeah.
I think in general terms, keep a sense of perspective. Okay, just be aware of what you've got and what a lot of people haven't got. Many of our problems are first world problems. I think it was Mark Twain that said, "I've had thousands of problems in my life, none of which happened." Okay, by which he meant he worried unnecessarily. And talking of quotes, Swift once said, "The three best doctors are Dr. Diet, Dr. Quiet, and Dr. Merriman." And that still applies today. In terms of mental health, I would simply say talk, speak up, speak out, and speak loud. And that's it.
So that concludes today's episode. Thank you, Dad, very much. If you enjoyed the episode, please do let us know. If you didn't, let us know. Please talk to us. We're desperate. You can email us at lifearewethereyet@gmail.com. You can also follow us on Instagram. Yes, we do have an Instagram. I know we were just slating social media before, but yes, we do, for some little video excerpts, behind the scenes stuff, and other bits and bobs like that. And that's at Life Are We There Yet? Dad, you can be found on Twitter at Roger the Doctor, if you don't mind me saying. We can always take that out. And that's it. So yeah, thank you, Dad, for joining us. Thank you, Isaac, for so admirably co-hosting, as always. And thank you, me, for no reason whatsoever. So, as always, just keep plodding along, and goodbye.